You're listening to an encore presentation of Morton in the Morning.
It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and thanks for tuning in to this episode of Morton in the Morning, our new radio show broadcasting right here from Morton Hospital in Taunton. We hope you've been enjoying our show, and we look forward to joining you for many more to come. We also want to hear your ideas and feedback. If you want to suggest topics for us to discuss on our show, or if you have questions you'd like us to answer on air, send them to us at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. So for today's show, we have two special guests lined up to talk about the topics of mental health and positive psychology. And if positive psychology is a new term that you've never heard, you'll definitely want to hear the great information and helpful tips on positivity in today's segment. So to kick off our show, we're broadcasting right here from Steward Medical Group Internal Medicine Health Associates practice in the John Adams Medical Building in Taunton, along with our first special guest, Dr. Yun Shah. Okay, so thank you so much, Dr. Shah, for being with us today. Can you start by telling the listeners a bit about yourself and your background?
Oh, thank you for interviewing me. I'm a primary care physician at John Adams Health Center, affiliated with Morton Hospital.
Okay, great. So tell us a bit about the SMG Internal Medicine Health Associates practice and a little bit about the team here.
Okay. Yeah, we have, this is a multi-specialty team.
Okay.
We have internal medicine, endocrinology, urology, nephrology, and also dietitian here. We have 7 providers specialized in primary care.
Wow.
And provide a full spectrum of service to the patients.
Okay, does that include doctors only, or is it doctors, mid-level providers as well?
Yes, we have, in the PCP team, we have 4 MDs, 2 NP, and 1 PA.
Okay, wow. So a large group you have here. You must see a lot of patients every year.
Yes, we do. And it's very good in that we have endocrinology and a dietitian support. That's a very big support to our practice.
Absolutely. So if someone needs a referral, you have folks right in the same building that you can refer them to.
Yes. And also, we easily can approach them to ask some suggestions for diabetic management, which is occupies a large portion of our patient population.
Absolutely. I know there's a high percentage of diabetes in Taunton, so that's wonderful. So how has your office been managing the COVID pandemic? Are you seeing patients in person or only virtually right now?
With the COVID-19, we have been seeing patients both in person and telehealth, both. We have never closed our clinic even one day, and we are very proud of that. And with the telehealth, actually offers a great advantage, especially for patients who has trouble with transportation, or they have concern about COVID-19 risk. So we offer telehealth with a phone call, with a video call. It's very convenient. But we also welcome everyone to come here.
And are there any barriers to telehealth? Are you still able to really assess your patients in the same way?
Telehealth, of course, is slightly different, but we want to provide the same standard of care to the patient, and our promise is not to compromise the care, because many diseases actually, it does not matter if we see patient in person or on the telephone or video. For example, diabetes, cholesterol issue, hypertension, we can manage the same on the telephone actually. And I learned a lot from this, and many patients like it too, because the convenience and the safety during this pandemic.
Absolutely. And actually, just coming into the office today, I noticed that it's actually quite busy with people coming in for in-person appointments. But there's also a lot of, infection control protocols and safety measures in place to make sure the patients feel safe.
It is true. We have been very cautious since the start. We check a patient's temperature, and also we try to have patients not to wait in the waiting area. We have them sit in the car. We have never slowed down, actually. We are fortunate, thanks for the patient trust. During this pandemic, we offer a lot of in-person care and also a lot of telephone call, and we are quite busy so far.
Okay, well, that's great. So I know that in addition to your internal medicine expertise, you've also developed an interest in the area of positive psychology. So what exactly is that, and what prompted your interest in that area?
Because as a physician, I realize I have so many patients with depression, anxiety, and mood disorder become so common, and a lot of other disease actually can be triggered by mood disorder. And for example, we lost the control of follow up because we're so depressed. We don't care about the diabetes, our cholesterol, our blood pressure, and then eventually become stroke and heart attack. So I feel a lot of times if we can improve our mental health and we change our mindset, a lot of chronic disease or acute disease can be prevented. That triggers my interest. And I would say among my patient visit, I think in all primary care office, about 20-30% of patients, they come either for purely stress or stress-related problem.
I'm sure, especially during this time, I'm sure over the past few months, that's definitely affected folks.
Oh, it is true. I think during this pandemic, especially during the peak time, about 30 or 40% of visit, actually, patients are complaining of stress.
Wow, that's amazing. Now, I had been speaking with you earlier. You mentioned that you were actually going to be taking, I believe, a board exam in an area called lifestyle medicine. So what is that, and how do you incorporate that into the care that you provide to your patients?
Oh, I have always been interested in preventive medicine because I believe prevention is the best medicine. Until last year, I went to a Harvard-hosted CME classes. At the end, they're introducing lifestyle medicine, and then I realized that's really something I've been seeking after, because the lifestyle medicine put an emphasis on chronic disease prevention. And in the United States, 80% of all healthcare spending in the United States are actually related to chronic disease, and most of disease actually can be prevented. And their study shows 80% of diabetes, stroke, and heart attack can be prevented. Even 40% of cancer can be prevented. And the lifestyle medicine advocate for whole food dietary lifestyle, regulatory physical exercise, and good sleep habits, and stress management and relationship, good social connection to minimize the risk of developing to chronic illness. I really think that's what medicine should be, to prevent rather than chase the tail.
Yeah, that's really interesting, because there's certainly, a shift in looking more at preventative health versus just reacting when someone has some sort of a chronic health condition. So that is really interesting. It sounds like we're going to see more of this perhaps moving forward, do you think?
Yes, WHO actually put a prevention as we have 3-level prevention. The first is a true prevention, which is prevent chronic disease from happening. And the second is what we're doing, most physicians are doing now, just to treat disease. Mm-hmm. But I feel the first till we should, if we spend money and we put our efforts to prevent, then most people can improve their life quality to prevent disease from happening. And I plan to attend a full spectrum of lifestyle medicine conference and take a board exam in November this year. And afterwards, I look forward to providing more comprehensive care, preventive care, in addition to my internal medicine expertise.
That's great. Well, congratulations and best of luck there. So we're just going to take a quick break, and when we come back, we're going to dive a bit more into positive psychology, what it means, and what are some techniques that you can use in your everyday life to increase your positivity.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Thanks so much for sticking with us during that short break. We're back with Morton in the Morning, and we're sitting here with Dr. Yun Shah, who's a primary care provider, but who also has a special interest in positive psychology. So this is a very interesting topic. I have lots more questions for you, Dr. Shah, so I'd love to get right back into it. So I know that positive psychology has a lot to do with mindfulness and increasing positivity in your life. So can you talk a little bit to the listeners about what are the key elements associated with that, and how can they incorporate some of those elements into their own daily lives?
And there's the base foundation of positive psychology is to make the life have a meaning and have more meaning, have positive emotion, and build a connection with other people. So there are key elements including being grateful, forgive other people, forgive ourselves, including practicing mindfulness, and have a growth mindset. I really want to emphasize for a few things, for example, being mindful and having a growth mindset, because for example, some patient will tell me, I always drink soda since I was a kid. And I always cannot control my temper. But from what I in touch with my patient, for example, today I have one patient, he is very obese, but he said he decided from January 1st to lose weight. He totally changed the lifestyle. He'd been eating a lot of vegetables, reduced soda. And today he lost, in the past 6 months, he lost 100 pounds. And he realized that too, actually, we can control our mind. We don't let mind control ourselves, and we can have a growth mindset and to change the bad habits and be grateful. It's also very important because I did notice some people and they have a lot of depression, anxiety. When I teach them to be more thankful for what they have, when they practice, they do realize they actually focus on positive side of their life instead of negative things, which is very important for our mental health.
And what are some tips that you would give to someone who's trying to incorporate more positivity into their lives? What are some things that they can do either at home or, just, in their minds? What are some things they can think about, even if they're, driving in their car? How can people make an effort to be more positive?
I can introduce some simple tips. If one small things you can do, which I learned from a friend too, think of 3 good things. It's called 3 good things. Every morning before you start your day, think of 3 good things. And at the very beginning, it may be hard to think of 3 good things because we always think we deserve what we have. We just need to have more. But if you really think of 3 good things, and including myself, when I start, I feel 3 good things. I feel everything's normal. They're not really 3 good things, just 3 normal things, I would say. So I have to force myself to think of what is good 3 great things. But then I practice. You don't even need to do it every day, but when you think of it, just do it. Then with time, actually, we'll develop a habit to just think of 3 great things. And now, for example, myself, when I think of if I have stress day and I will think tomorrow I have enjoy a cup of coffee and enjoy the flowers in my garden. All becomes really good things, and it actually improved my level of happiness. And other things is live with uncertainty, and especially now we have no control of the virus. We don't know what's happening, but we have to teach ourselves we can live with uncertainty. We don't have to have an answer when this will be finished. Like today, my patient asked me, do I think it will be over? I said, well, definitely be over. When? We don't know, but we have to learn with it. And the other tips is, and when we have bad thoughts, there are technique, actually. There are truly technique, for example, replacement. And when you have negative thought, immediately replace with a good one. And a bad habit, for example, my patient has been smoking, then she decided to buy some coloring book. When she wants to smoke, she replaced with coloring. Then that's the way she stopped smoking.
That's great. Well, actually, I know I've heard of the adult coloring books that are meant to be actually for stress relief and to make you feel a little bit calm.
Yes. That's actually coloring is a way of a mindfulness practice, because gardening, coloring, sewing, reading, walking, eating, and you can actually make everything mindful as long as you want to. And I learned this actually from a patient who told me she used to have a lot of stress and she has a blood pressure issue, have a migraine, but then she started to practice the mindfulness. That time actually my patient is my teacher. She become my teacher in a way. She told me, and you can practice mindfulness, but I told her I'm so busy, I don't have time to sit there. I saw at the beginning, I saw the mindfulness just sitting there quietly. She said you can practicing mindfulness by walking. That triggered my interest. Then I realized we can eating mindfully, we can walk mindfully. There are tips how to do it.
Interesting. Well, maybe your patient should go to the course with you on the lifestyle medicine. It sounds like she has some good interest in that too.
Yes, actually, I'm teaching mindfulness. I have already give 3 speeches on mindfulness, and I wrote some article on mindfulness, and I'm willing to share with the community. That's what I learned, and also what I learned, and some tips, and I'm very happy to share with.
Oh, that's great. So where have you started sharing the messages? What presentations have you done out in the community?
And I give 2 Zoom mindfulness already, and I have also in our clinic I give mindfulness practice, and I also integrate that into my daily practice. Every time when I see patients when they have stress or they are anxious about this COVID-19, and I teach them to live one day at a time, put the mind in today, and we don't have to control the virus, but we can control what we eat, how we think. Hopefully we can learn to control our mind. And I really enjoyed what my patient told me. She's a very mindful person. She said, if we wake up without fever, that's a good day to start.
Yeah.
When we go to bed without fever, that's a successful day to celebrate. I always keep that in my mind tell myself to live one day at a time.
It's very interesting, and I know you've also done some presentations even to the hospital staff, which has been very helpful. And last year, you were one of the speakers. The Cranberry Country Chamber of Commerce had a great event. It was an event for women. It was called Elements for Excellence. And you presented many of those concepts there, and it was so well received. It's really inspirational to try to learn some of these techniques and try yourself to incorporate them into your lives, because it really is helpful.
Thank you very much.
So do you have any more examples of how these concepts have helped patients or family members or friends? I know you even spoke about how it's helped yourself, but any other good examples?
I teach my patients, for example, I tell many of my patients this word pause. Why do I say that? Because a lot of time we're doing things out of habit. We eat without even thinking if we need it. Or we smoke, we don't think if it's bad for our health. Or we talk to someone because we're just habitually say so and irritate the other person. So I tell my patient just to write a pause. on a piece of paper and then put on the refrigerator, put it in your bedroom, put it in your kitchen. And before you take that bite, just pause and think, do I really need to do that? And when you want to yell at someone, just pause, because it's a lot of times our thinking, it's just like clouds. It comes and it goes. As sometimes it just takes 2 or 3 seconds when we pause and then realize what we are doing, just to put our mind to it, we can stop. And with that, actually, many patients come back, they told me they put pause on their refrigerator door. And by doing that, quite some patients told me they lost 4 or 5 pounds.
Wow.
Just before they open the refrigerator door, they pause, and they think, I really don't need to eat that.
Yeah.
So
interesting, very interesting. So obviously we're going through, a difficult time this year with the COVID-19 pandemic. A lot of people, as we had talked about, are, stressed out, they're fearful, there's a lot of uncertainty. So what one piece of advice would you give to anyone who's struggling or feeling a bit down right now during this unique time?
I will quote this sentence to give to the people. This too shall pass. Many people heard about this sentence. There's different origin from this word. Some say it's from a fable, and some say from the Bible. And I tell you, I always tell myself and I tell my patient, even our life is temporary, not to say our difficulty. This will pass, and this will definitely, I always tell patients, there's never ever in the history natural disaster did not pass.
Yeah.
It will always. But we also remember the good things will pass too. So when we have good things, just think it will pass. That's why we have to enjoy every moment. When we have a difficulty, we'll say this shall pass. So we will just take one day at a time, live at present moment.
Okay, well, yep, it's all about being positive, right? So this will pass, but certainly for anyone who's concerned, you've given some really great tips and techniques and just some really great advice to everyone today. So very fascinating. I think this is such an interesting topic. Thank you so much, Dr. Shah. Look forward to hopefully attending another one of your presentations again in the future. And once you have some scheduled, we'll definitely get the word out to the community as well.
Yes. I'm interested in giving video conference on the internet to cross to many people. And also I realized writing can be a very effective way to spread more words to the patient. And please watch for the Morton website for further update about the upcoming internet conference.
Excellent. Well, thank you so much for all you do and all you do for your patients in this community. We appreciate you being here.
Thank you very much for letting me talk.
All right. And again, Dr. Shah is located at the SMG Internal Medicine Health Associates building, right up in the Miles Standish Industrial Park. So right near 495 off of Bay Street. So conveniently located. You can find her on the Morton website. Or if you're interested in making an appointment here, you can call 508-822-2266.
Thank you very much.
You, Dr.
We
Shah.
welcome everyone.
Okay, so we'll be right back after another short break, and when we return, for the second half of our show, we have another special guest, our Chief of Psychiatry, Dr. Leonardo Battista. So we'll talk with Dr. Battista a bit about his background, about the growing range of mental health services available at Morton Hospital, and get his advice for anyone who's currently struggling or just feeling a bit down. So stay with us, and we'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street, with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.
You're listening to an encore presentation of Morton in the Morning.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back, everyone. I'm your host, Julie, and thank you for joining us for more Morton in the Morning. So far during this segment, we've spoken with Dr. Yun Shah about the topics of mindfulness and positive psychology. And for the second half of our program, we're sitting here in the office of Dr. Leonardo Battista, who is our Chief of Psychiatry. And we're going to hear a little bit more from him about the psychiatry services available at Morton and some of his tips on how people can cope during this time. Good morning, Dr. Battista. How are you?
Good morning, Julie. How are you doing?
I'm well. Thank you so much for being here with us today.
Oh, thanks for inviting me.
All right, so let's this is such a great topic of mental health. We know that mental health plays such an important role in overall health, so let's get right into it because I have a lot of questions for you. But let's start by having you tell the listeners a bit about yourself and your background.
Okay, so my name is Leonardo Battista. I was born and raised in Brazil, a beautiful country down in South America. Our first language there is Portuguese, so I'm glad to be able to not only communicate but also to be culturally competent to the needs of our Portuguese-speaking communities.
That's excellent.
So I first, it's interesting. I first started my grad school as a dental surgeon. So I graduated as a dental surgeon before entering medical school. And then I did the whole medical school after that. And then after that, I came to this beautiful country, the U.S., and I worked in Boston at Mass General for 3 years, where I did a postdoc in neurology at the Department of Neurology there at Harvard Medical School. And after that, I became much more attuned of people's emotions and the emotional components of the mind and the brain. So I decided to do a specialty or residency in psychiatry. So I went to Brown, finished that for 4 years, and after that I worked with them for 4 years as a faculty, as an assistant professor, and as an attending psychiatrist at Rhode Island Hospital, where I directed the Portuguese and Latino clinic over there, and also taught things like ECT, which is the electroshock treatment, and the cultural psychiatry and other interesting things that I brought here as the chief of psychiatry as of September 1st last year.
Well, that's very interesting. You sound very accomplished. It sounds like you've done it all, basically.
Yeah, so it was 18 years of grad and post-grad school to try to be ready for the needs of our community. So who has graciously welcomed me.
Wonderful. So can you talk a little bit about what's the actual difference between psychiatry, which is your specialty, and psychology? Are they different?
Well, I'm actually very happy that you brought this up because I thought that for the rest of my life I would be trying to educate people on the difference because it's tricky, right? The words sound similar, but they're actually very different professions. So in one hand, you have psychology, important part of the mental health team, but they do psychology school. So they usually do a PhD program. So they're not physicians, right, per se. They're not doctors. So they do comprehensive treatment in mental health, but mostly dedicated to psychotherapy, which we commonly know as talk therapy. So psychologists would do the talk therapy, right? And the psychiatrists go to medical school. They're your regular physician, like your neurologist, the dermatologist, your PCP, but they decided to specialize in the mind and the brain. So they do also some talk therapy, but they use other kind of biological treatments, like they prescribe medications for your depression, for your anxiety, for your sleep, for your PTSD, and so forth. So they work together, ideally, in a comprehensive mental health program, but one is more focused on the non-medication part of it, and the others we'll do also the medication.
Okay, well, that's very interesting. I mean, I certainly never knew the difference, and I'm sure some of our listeners didn't understand that there's a difference as well. So thank you very much for that.
Yeah, that's great too.
One of the things you mentioned that you speak Portuguese, and you've done some work with the Portuguese community. I know that you have also done some specific work around reducing the stigma associated with mental illness in the Portuguese community, and you actually received some recognition for that. Can you tell the listeners about that?
Yeah, so it was very humbling, and but I welcomed that award, very happily. It was, well, first I started, like you said, so I started working with the Brazilian and the Portuguese-speaking community, giving some assistance also to the Embassy of Brazil in Boston. Wow. So it started because I was invited by the ambassador there to put together a booklet on prevention of suicide in an immigrant community, which was very well received, to the point that the Ministry of International Relationships in Brazil, so they put that in their website and published to all embassies of Brazil in the world.
Wow, that's amazing.
So I guess it was well received by the Portuguese-speaking community here, and then I was started to be invited to do more like talks in non-governmental organizations across the state of Massachusetts, and then to the point that one of them, the New England Community Center, decided to award the ambassador, myself, and a couple other people the Person of the Year.
Wow!
And that was in 2017.
Okay.
I want to say, yeah. And then just last year, another non-governmental organization that called Say Yes to Life. So they awarded me because of the awareness and mental health and prevention of suicide.
Well, that's incredible. Well, thank you for your work, and congratulations there.
Thank you.
So let's talk a little bit about the mental health services available here at Morton. Can you provide an overview of what services are currently available to our community?
Yeah, so we're very excited about the, some of the work that has been done here prior to my arrival, and then the expansions that we recently did. So we have inpatient psychiatry, which means that we have a dedicated psychiatric unit for patients who need to be hospitalized because of mental health needs.
Okay,
that we call the
for
EDHS.
Seniors, correct?
Correct.
Okay.
It's the Elderly Behavior Health Service for seniors 55 and over.
Okay.
So we have that component, which is the inpatient. We have a dedicated psychiatric emergency room. So instead of just being seen by the regular physician in the emergency room, you also have the mental health component of it, which is in a separate area of the ER, where you're going to have your mental health needs addressed. And you'll be from there hooked up with the services that you need, either in the hospital or in the clinic outside of the hospital. And that brings us to the third program we have, which is the outpatient clinic. That's where we're speaking from now, right? So this area here, it's a very nice area that was provided by Morton Hospital, where we built this clinic. So we have scheduled appointments, just like you would go to see your primary care, family doctor, your neurologist. So you can come and see one of us here in the psychiatric clinic by appointments and through referrals from your primary care physician. Okay. And we have also a consultation service, which provides psychiatric co-management in patients who are, for instance, in the medical floor or surgical floor or the ICU. Okay. Right? You don't know when you're going to need to see a psychiatrist, and sometimes you are in the hospital already. But you are depressed, or you're going through some periods of adjustment because of other medical problems you have. So we are available to be consulted by your primary team to go there bedside and help you with what you need. And the last one was just recently we got our certification and approval by both Department of Mental Health and Public Health to start a state-of-the-art neuromodulation technique, which is the single most effective treatment for severe depression, that we call ECT, electroconvulsive therapy, also known as the electroshock.
Okay.
That has been the gold standard for treatment for severe depression for the past 80 years. And now we have readily available here in our community.
Well, that's interesting. It sounds like the full complement of care is available here. Going back to the outpatient clinic, do patients need a referral from their primary care doctor, or can they call themselves and book an appointment?
Well, they can call, and then our secretary will actually help them navigate into the logistics of getting the actual appointment.
Okay.
Which one of the steps will include a referral from the primary care, because it's very important, Julie, for us to close the loop on what the patient needs, right? So I cannot just see someone as someone with a problem in their mind or a problem with their shoulder. So because we see the patient as a whole, and so we need to have this close relationship with their family doctor to make sure that we understand all the needs of our patients.
Interesting. And now you spoke about the new program of ECT. Is that something that's offered in many hospitals, or is that pretty unique?
No, that is pretty unique. We're the only facility in southern Massachusetts right now.
Okay.
So even though it has been, a gold standard for about 80 years in
Okay.
the world, but very few hospitals offer that. You need a particular training for that, very rigorous certification, a dedicated area, dedicated recovery area, specialized anesthesia, procedure list that includes, nurses with specific trainings and psychiatrists that are familiar with the procedures. So we were happy to start this program right now here.
Okay. And you mentioned that it's also known as electric shock therapy. Now, to the average person, that might sound kind of scary. So if you recommend this treatment for someone, what do you say to them to sort of ease their fears about what it's about?
Yeah, so, I used to teach that class at Brown.
Okay.
So I was a teacher of electroshock, right, for future psychiatrists and medical students. And one of the things that I used to talk about is the stigma, like you brought up. So I used to share with them a scene from the movie One Flew Out of the Cuckoo's Nest
Yes.
with Jack Nicholson, right? So, but let me tell you, that is largely inaccurate,
Okay.
right? That does not happen. People are not going to be shocked without anesthesia, proper indication, or being used as almost a retaliation for patients' behaviors or punishment. These things are fictional, and it skewed people's perception to a very negative, understanding of ECT. That is absolutely false, right? That was Hollywood.
Okay.
That does not happen. So it's a very humane treatment. We have a outpatient session here. A patient would come to the clinic, would talk to me, one of the psychiatrists. They would have a comprehensive psychiatric evaluation. If they need or if they have indication for it, they would have to go through a medical clearance with their primary care. They will meet with the anesthesiologist. It's like any small procedures that you would do. For example, you get your EGD because you have acid reflux, right?
Okay.
So you go on a day to the hospital, you come in early, the anesthesiologist talk to you, the nurse, they take an IV line, they give you fluids, and at some point they give you a sedation just to do the procedure. The procedure itself, it takes 1 minute, literally.
Okay.
Where you're in a very controlled environment where I monitor your brain activity, your sleep, your pulse, your heart, with the help of your anesthesiologist and your nurse. And then you'll be sleeping for only about 60 seconds or a minute and a half or so during the time where I would apply this very small amount of energy to the scalp, because with that energy being released, we see that the brain activity starts recovering in a way that will protect you from depression or treat your depression.
Very, very interesting. So is this a type of procedure that's done like in our surgery center?
Yes.
Okay.
So we have a dedicated area here in the PACU to do that.
Okay.
In a very safe, controlled, and again, you can do this even as an outpatient. So you come during the day, early in the morning, and then after a couple hours, you're ready to go home. With assistance, and recovery is usually very good.
Okay. Well, this is such great information. Thank you so much for sharing us. We're just going to take one more final break, and we'll be right back with more Morton in the Morning and Dr. Leonardo Battista at Morton Hospital.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back, everyone, to our final segment of today's Morton in the Morning show. We're sitting here with Dr. Leonardo Battista, Chief of Psychiatry at Morton Hospital, who was just telling us about a new program at the hospital called ECT. And we were just talking about the types of conditions that ECT helps to treat. And you mentioned depression. What other types of conditions might ECT be an appropriate treatment for?
Yeah, so with a variety of mental health symptoms or illnesses. So any type of depression, both what we call the regular or unipolar depression as well as the bipolar depression. People who suffer from bipolar illness, sometimes they have what it's called manic episodes.
Okay.
So for acute mania, this is also a good treatment. It's the go-to treatment for a very severe mental health symptom that it's called catatonia.
Okay.
Some patients will be unable to move or to talk when they are in such severe status that is called catatonic status. So the ECT lifts that almost immediately. Schizophrenia and intractable seizures even though we are inducing a controlled seizure that lasts for like 20 to 40 seconds. So, but neurologists sometimes even refer patients to us when people have such difficult to control seizures that they need almost like the reboot a session with ECT that actually rearranges the way that the brain areas will communicate, so it can help also with intractable seizures and even with severe tremors like Parkinson's. Sometimes I've done ECT on patients with severe Parkinson's that were referred to me by a renowned specialist in movement disorder. So there's a variety of indications that we're happy to discuss with the patients.
Okay. Well, that's fascinating. I think it's amazing that we have that treatment option here at Morton Hospital. So thank you for helping to bring that here.
Absolutely.
And in the outpatient clinic, what are some of the more common issues or concerns that patients come and you work with them on?
So I would say the most common complaint in outpatient psychiatry is are depression and anxiety.
Okay.
Because these are the most common mental health ailments in the world. And also people suffering from sleep problems.
Okay.
I would say these are the most common ones.
Okay. And aside from ECT, what are the other treatment options that you offer in the outpatient setting?
So we're in the process of also hiring a psychologist, or a therapist, actually, because a therapist, someone who can do psychotherapy, not necessarily as a psychologist, it could be a social worker who is licensed for that. So we're hiring a therapist. So we can do combined efforts with medication and non-medication treatments. So this is another part of the treatment that is offered in the outpatient.
Okay. And I understand you also just welcomed a second psychiatry specialist to the clinic and to the hospital psychiatry team.
Right. So Dr. Anna Maria Moldovan worked very close with me for a number of years at Brown. So she is, an excellent clinician, and she is very much attuned to patients' emotional needs, and she has been a a tremendous addition to the team. She was a professor before in Virginia and then at Brown. She was a mentor in psychotherapy. So she is a great addition because what she brings in terms of experience in both medication and also therapy, that is very singular to what she is coming with.
Wonderful. And in the clinic, are you doing both in-person and virtual visits at this time?
Yeah, we are. We never discontinued any of our services here during the pandemic.
Okay.
Because it's such a need for the community. We cannot just pretend that this is not hitting virtually all of us, right? So we continued our outpatient sessions with telepsych, both by video and phone sessions.
Okay.
And now we are reopening, so we are offering some sessions that are presential, so in-person sessions, but we also continue with the phone sessions too.
So you mentioned that you remained open during the pandemic over the past few months. And these past few months have certainly been difficult for many people. So what advice do you have for anyone who continues to struggle with, social distancing guidelines or just fear of the COVID pandemic in general?
Right. So this is a very important topic these days, and I think it's going to stay very important, from now on, because we can definitely see that how things have changed in the world and relationships have been reshaped and the way that we communicate or relate to people. So it wouldn't be different on the way that we also perceive, our own life, right? So we have a lot of people struggling, but definitely all of us adjusting to this situation. Some will do in a better way, others will do in a more difficult way because of their particular needs or the way that they live. Some people are more kind of reserved already, or they don't have a big, social networking per se.
Sure.
So these things could have been aggravated during this time of pandemic, but we have to understand that the social distancing does not mean social isolation and should not, especially at this day and age where we can, we're just a single phone call or a text away from the next person, right? So I say that we need to, more than ever, kind of wisely use technology to help us to get through and not isolate. So the physical distance of 6 feet to prevent contamination is one thing, has nothing to do with you being isolated from the world. Right, and the fear, of course, it's part of the adjustment because it's the unseen or the unknown. But the more we know now about, how to protect yourself, we should be able to kind of make accommodations in our daily routine to not let that take over our life as a way of a phobia, for example, or obsessive compulsive rituals that would make you kind of dysfunctional. But I would definitely say that you should reach out to people that you love more often. Reach out to your doctors, because doctors are also like people like you and I who have been, going through their adjustments too.
Sure.
With their kids at home, not having school, or the difference in the way that they can approach their patients. So as any other human, your doctor will be prepared to discuss these things with you. So you should not hesitate to call more often, to have more frequent visits, because that's one thing that the telemedicine has brought to us as a blessing, was more readily available care.
Okay. And that leads into my last question. What would you say to someone who thinks that, they're going through a tough time, they might benefit from meeting with a psychiatrist, but they're just nervous to do so. They're nervous to take that first step.
Yeah, so I would say that it should be as simple as reaching out to your family doctor, right? So since we are mind and body, we are biological, psychological, social, and spiritual beings. So I don't think that psychological part should suffer, right? So if you have a need for if you have a pain in your foot, you go to the foot surgeon. If you have, problem with your eyes, you go to the eye doctor. If you don't feel good, if you feel sad, anxious, preoccupied, can't sleep, definitely should seek help from your psychiatrist.
Okay.
He or she would definitely be more than happy kind of to help you to go through the struggles.
Okay. And before we end, is there anything else you'd want to share with the community about the program here, or just anything in general?
So I just would like to thank everyone actually for welcoming me here to the community. You know, it has been a tremendous time to be here. You know, I feel that I fit right in, you know, for the cultural aspects, for the values that this strong community has, you know, brought together, the strength during these times of need. So I'm here as part of the community, a community doctor to serve and work together. So you guys feel free to reach out to us, and you're more than welcome to join us in our program here.
Excellent. Well, we've been certainly very happy to have you, and in the short time that you've been here, you've done so much already in building our mental health services and also so much for the community. So thank you for that, Dr. Batista. And if anyone is interested in learning more about the outpatient psychiatry clinic, you can certainly check out our website, mortonhospital.org, or call the clinic at 508-828-7880. Thank you very much, Dr. Batista. This was a wonderful segment.
Thanks for having me.
Okay, take care. All right. Well, we hope everyone enjoyed today's show. It's such an important topic that we probably could have gone on for another hour, but that's it for today before we join you again next Wednesday. So today we spoke with Dr. Yun Shah, primary care specialist at SMG Internal Medicine Health Associates in Taunton, affiliated with Morton Hospital, as well as Dr. Leonardo Batista, our chief of psychiatry. If you'd like to learn more about Dr. Shah or request an appointment, you can call her office at 508-822-2266. Or if you're interested in our outpatient psychiatry clinic and seeing one of our providers there, give us a call at 508-828-7880. As always, you can stay up to date on everything happening at Morton Hospital by visiting our website, mortonhospital.org, or following us on Facebook at facebook.com/Morton Hospital MA. We look forward to joining you again next week. As a reminder, if you'd like to send us any ideas for our show, or if you have questions you want us to answer on air, send us an email at mortoninthemorning@steward.org, MORTON in the morning @STEWARD.org. We hope to hear from you, and we hope you'll join us again next week. Have a great week, everyone. Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street, with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.